Okay, today we're going to have a little mini lecture on how to put the exercises you've learned so far in principles in RS1 and RS2 together with your findings from the fitness screen. So we've looked at the fitness screen in principles, we've looked at each weekend that we've been together, and this is just to help you look at it with those exercises in mind and start to think about how you're going to choose exercises as soon as you see on that fitness screen result that's provided in your book. As soon as you see what the limitations are, you're already thinking about the fine points of how it's graded and what movements you're going to be thinking about right from the very beginning. So what I've done is written down, this is from your book, basically what the test is testing for. So this is going to be something you could put on a worksheet if it helps you to look at the reasons that we're doing these tests. And then just for to get the thoughts going, and especially for the rehab folks that are using the Nagi grid, and we don't quite have the emphasis on the fitness screen for rehab as we do on the Nagi grid, and your problem solving, your stages, and so on and so forth. But it's still very, very useful for you to know and be familiar with the fitness screen. And the fitness screen is a tool for you to use as a way to objectively quantify improvement over periods of time. It's used to decide where to put a new client into a class level if you have a beginning, intermediate, and advanced, which you most likely will wherever you're working. Or even just as a therapist, if you've got somebody that's, if you've got one of the businesses like mine where it's kind of a gray area between PT and Pilates, who do I get as a Pilates client that doesn't have some therapy issues? Nobody. So it's useful to have this tool. I use both in my practice. So this is for everybody in the course, the S's and the R's. So first of all, let's start with our half squat and just kind of take a look at it. So the half squat tests for disassociation of the hips from the pelvis and lumbar spine, and it tests to see if that client can maintain their spine in neutral. So I just highlighted disassociation and put in brackets here stabilization for spine in neutral. And again, those are concepts that are more geared towards the rehab people than the studio folks. So I'm trying to frame this in a way that our rehab folks are going to be kind of looking at this, as well as the studio. It's helpful for you guys to know this too, because we talk about it in our discussions. So we've got some disassociation and stabilization that we're already looking at in the test. That should give you a big step forward into what you're thinking about as far as exercises that you're going to want to put into this program for somebody who is showing a lack of ability to disassociate or a lack of ability to stabilize the spine. Okay, so that's kind of how we're going to go through it. The full squat, lower extremity strength or leg strength, and control in full knee flexion. Again, that's going to require disassociation and stabilization, but we're also looking at strength and control. We're throwing some other things in here. We're going to get to applying the principles as soon as we get going through all of this list, so don't worry, we're getting there. The heel raise, basically calf muscle strength and balance. So a part of the balance piece is going to be some stability. There's going to be some stabilization involved. All right, so I've highlighted stabilization in there, something that you can be thinking about. They're going to need to have that ability to stabilize the relationship of the rib cage to the pelvis in order to raise up onto those balls of the feet unassisted without having to hold on to something. Goal post on the wall, postural alignment is being tested here. What are the things that we often see? We often see that thoracic spine extension coming away from the wall. If they can't get the arms back there, they're going to compensate with thoracic spine extension. Shoulder abduction and external rotation, and again the spine control, exactly what I was just talking about with the extension. So there's got to be some disassociation of the upper extremity from the trunk. Right? Maybe we haven't talked about that a whole lot yet because we haven't had a whole lot of upper extremity repertoire at this point. But there is going to be that thinking about the ability to disassociate that arm movement so that when the arm is raised, it doesn't just go right into a thoracic extension to reach. Right? We want to be able to achieve that full range of motion before we add the extension. So there's our disassociation at the shoulder joint and the stabilization of the trunk, specifically of the thoracic spine as we look at this particular test. The long sit test, primarily hamstring flexibility, and then that spine stability on top of that hamstring flexibility. So then again, there's that disassociation at the hip, along with that ability to maintain the rib to pelvis connection as they're seated. Seated hip abduction next. Length of hip abductors, so the inner thighs. Capsular restriction. So that's the capsular restriction that could potentially be there around each hip. Right? In the seated hip abduction, we're going to see it again in the Z-sit mermaid. I'm just getting ahead of myself. In this position, we could see some capsular restriction causing maybe a position of the pelvis that's in too much of an anterior tilt, too much of a posterior tilt. That can be a reflection of capsular restriction, or just simply the inability to get the legs apart. Core stability is that ability to keep the pelvis in a fairly vertical relationship to the ground. So again, there's got to be some disassociation at the hip and some stability of the relationship of rib cage to pelvis. Z-sitting is your mermaid position, which is also sometimes called figure 4. It's getting into the internal and external rotation flexibility. You're also going to be looking potentially at some capsular issues there. And range of motion into hip, internal and external rotation. You're also going to be kind of looking for some of that core stability too. This is one of those positions where you're going to tend to see a lot of extension in the spine. So again, you've got your disassociation stabilization that's being tested here. So for the roll-up, spine flexor strength and articulation into flexion. So we're looking into our segmental articulation now, but we're looking at that spine flexor strength. So it doesn't really say we're looking at abdominal strength. We kind of are. The abdominals being spine flexors. So you're thinking that as you're looking at the quality of the movement. So since we're looking at that articulation, we're looking at mobilization. You can see that we've switched from that disassociation and stabilization into mobilization now. The 100 is deep abdominal control in spine flexion in a sustained position of upper spine flexion. So, you've got the elements of stabilization, but you've also got some elements of mobilization just in a limited part of the spine. You can look at it in both ways. Not much in the way of disassociation here, though. Side lift, trunk and shoulder girdle stability, and hip abductor, so away from the body, abductor strength. Okay, so we're looking at the ability to disassociate, and with that lift of the leg into hip abduction, where we're testing that hip abductor strength, we've got to have some stability of the trunk, as well as that, there we go, we've got the trunk stability, the shoulder girdle stability, but the hip abduction has got to have your disassociation. The stabilization speaks to that trunk and shoulder stability. Now we're over to the last column here, push-up. So we're looking at upper extremity strength now. We haven't really looked at that. And scapular stability, which we just took a look at in side lift. So here, we're looking at the stability of the trunk, but we're really not saying that that's a big part of what we're looking at in the verbiage that's associated with our look at the test. But really you are taking a look at that. So I put disassociation primarily, but stabilization as well. You're watching for that sagging of the spine. You're watching for that maintenance of the rib cage to pelvis connection. So you've got the disassociation, and why did I put that primarily? Because we are looking at the strength and the scapular stability, the ability to disassociate again. Here's that arm from the thoracic spine, much as we saw in goalpost on the wall. Superman, there's spine and hip strength and flexibility now into extension. So this is a little bit of the opposite of roll up, because we were looking at into flexion, now we're into extension, but they're both going to be mobilization. You've got the hip strength element as well. There's not a great deal, though, of hip disassociation in here, which is why I have not included the disassociation into this. Prone shoulder flexion. Shoulder flexion strength and range of motion in the prone position. So here we've got a bit of disassociation of the upper extremity from the thoracic spine as you press down and lift up, so that it's not just all one movement. But you've got a little bit of some mobilization in there as well. It's a little more subtle and more limited. But we've got a bit of the disassociation of the upper extremity from the thoracic spine. I'm sorry, I went on to prone press-up. Prone shoulder flexion. There's the disassociation of the upper extremity from the thoracic spine. Pardon me. So now we're on to prone press-up. I've already given you all that. Distribution of spine extension between cervical, thoracic, and lumbar segments. So there is our mobilization, especially depending upon how high they come up. So your mobilization, prone press-up, and disassociation of the upper extremities from the thoracic spine, prone shoulder flexion. So sorry if I caused any confusion there. Prone knee bend is really hip flexor flexibility. So that's on the stomach, bending the knee to pull the heel towards the bottom. So we're taking up all the slack in the iliopsoas and the rectus femoris. So we're going all the way through the entire hip flexor complex that's starting from the lumbar spine and continuing through the anterior aspect of your femur and down with its attachment just beyond the kneecap. So there really isn't a whole lot of disassociation mobilization that fits into this one, so I'll just kind of let it be as it is. Now, everybody's got a good chance to look at this, write it down, use it as a format as you will. I'm going to erase the last two columns, and we're going to start to look at how the movement sequences that you've learned so far fit in to these classifications. So we're going to start with the half squat, and we've already determined that we've got some disassociation and some stabilization. And Tana, can I ask you to just erase that middle column so I can go in here? Thank you so much, my lovely assistant Tana. Tana White, nice, well done, Tana White. Yeah, she's hired. Okay, so we're going to look at, first of all, applying the principles, our 6 principles, to these tests. So for the half squat, and I'm going to preface this by saying pretty much in all of these, you're going to have core control and axial elongation, some more than others. But in every single one of these, you're going to have breathing. So let's make the assumption. We're just going to say, if you're doing a graph of this, you've already written in a B and a CC and AE, right? So your core control and your axial elongation. That'll just save a little bit of extra writing. So that's sort of understood. So here, we're looking at, in the half squat, our alignment and weight bearing of the lower extremities. Okay, so that's a really important thing about your half squat. That's one of the things you're looking at, because you're looking to see if those knees collapse in, if they roll out, what is that stability of the legs and keeping the spine in neutral. So the spine in neutral, we're taking care of that with our axial elongation and core control. Okay, so we're not forgetting about it. We're understanding that that's in there. So if you guys are all okay with that format, does that sound good?